Question 1. In palliative care for oncology patients, which of the following best reflects the nurse's responsibility in managing the patient's psychosocial well-being? A. Reassure the patient that the treatment will work. B. Focus solely on physical symptom management, avoiding discussions of emotional distress. C. Encourage open discussions about death and dying, and support the patient in their emotional needs. D. Minimize conversations about death to avoid causing further distress. Answer: C. Encourage open discussions about death and dying, and support the patient in their emotional needs. Rationale: the nurse should encourage open communication about difficult topics like death, helping the patient address emotional and psychosocial concerns, which is an essential aspect of palliative care. Question 2. A patient undergoing chemotherapy develops nausea and vomiting that is refractory to standard antiemetics. What is the most appropriate next step in management? A. Increase the dose of the current antiemetic. B. Switch to a different class of antiemetic, such as a corticosteroid or an K1 receptor antagonist. C. Administer an antacid to reduce stomach acidity. D. Suggest home remedies like ginger or acupuncture. Answer: B. Switch to a different class of antiemetic, such as a corticosteroid or an K1 receptor antagonist. Rationale: for patients with chemotherapy-induced nausea and vomiting (CNV), refractory to standard antiemetics, switching to more potent classes like corticosteroids or an K1 receptor antagonists is necessary. Question 3. A patient receiving radiation therapy for breast cancer presents with a moist, weeping, radiation-induced burn on the chest. What is the most appropriate nursing intervention? A. Apply a topical corticosteroid cream to the affected area. B. Keep the area dry and use an antimicrobial ointment. C. Apply a non-adherent dressing and keep the area moist with saline compresses. D. Recommend the patient wear a compression bandage to alleviate discomfort. Answer: C. Apply a non-adherent dressing and keep the area moist with saline compresses. Rationale: for moist desquamation, using a non-adherent dressing and saline compresses helps prevent infection and soothe the area. A topical corticosteroid could exacerbate irritation, and dry dressings might worsen the symptoms. Question 4. A patient undergoing chemotherapy for ovarian cancer is concerned about hair loss. What is the most appropriate response by the nurse? A. Hair loss is inevitable. You will need to accept it as part of the treatment. B. There are no solutions for hair loss, but we can help with emotional support. C. Hair loss is temporary, and we can explore options like wig fitting and scalp cooling systems. D. Hair loss is not a common side effect of chemotherapy for ovarian cancer. Answer: C. Hair loss is temporary, and we can explore options like wig fitting and scalp cooling systems. Rationale: hair loss due to chemotherapy is often temporary, and offering emotional and practical solutions, such as wig fitting and scalp cooling, is the best supportive care. Question 5. A patient with end-stage lung cancer is experiencing severe dyspnea. The physician orders morphine for symptom management. What is the most critical nursing action before administering the morphine? A. Ensure the patient's respiratory rate is within normal limits before administering. B. Assess the patient's level of pain using a pain scale before giving morphine. C. Confirm that the patient has not recently eaten to prevent nausea. D. Ensure the patient has not had a recent dose of anticholinergic medication. Answer: A. Ensure the patient's respiratory rate is within normal limits before administering. Rationale: morphine can suppress the respiratory drive, so it is critical to assess the patient's respiratory status before administering it to avoid respiratory depression. Question 6. In assessing a patient at risk for cervical cancer, which of the following risk factors is most predictive of developing this condition? A. Family history of lung cancer. B. Chronic pelvic inflammatory disease, PID, with multiple episodes. C. Use of oral contraceptives for more than 5 years. D. History of smoking and HPV infection. Answer: D. History of smoking and HPV infection. Rationale: smoking and HPV infection are significant risk factors for cervical cancer, with HPV being the primary cause. Options A, B, and C are less directly associated with this risk. Question 7. After administering chemotherapy, a patient's absolute neutrophil count, ANC, drops to 800 cells/μl. What is the most appropriate nursing intervention? A. Start the patient on a prophylactic antibiotic regimen. B. Immediately contact the physician to discuss dose reduction. C. Begin a regimen of iron supplements to improve hemoglobin levels. D. Encourage the patient to engage in light physical activity to boost circulation. Answer. A. Start the patient on a prophylactic antibiotic regimen. Rationale. A low ANC increases the risk for infections, and initiating antibiotics is critical to prevent infection. Dose reduction and iron supplementation are not indicated at this stage. Question 8. Chemotherapy-induced peripheral neuropathy, CIPN, can severely affect a patient's quality of life. What is the most appropriate intervention for managing CIPN symptoms? A. Advise the patient to avoid any physical activity to reduce nerve irritation. B. Prescribe gabapentin or other neuropathic pain agents as appropriate. C. Recommend increased vitamin B12 supplementation. D. Encourage the patient to increase salt intake to prevent dehydration. Answer. B. Prescribe gabapentin or other neuropathic pain agents as appropriate. Rationale. Gabapentin and other neuropathic agents are commonly prescribed for managing CIPN. Physical activity is important for maintaining function, and salt intake does not directly impact neuropathy symptoms. Question 9. A patient receiving radiation therapy to the abdomen begins to experience severe nausea and vomiting. Which of the following interventions is most effective in reducing these symptoms? A. Provide the patient with antiemetic medications as ordered, preferably before radiation. B. Encourage the patient to eat a large meal prior to radiation therapy. C. Administer a higher dose of corticosteroids to reduce inflammation. D. Avoid fluid intake until nausea subsides to prevent vomiting. Answer. A. Provide the patient with antiemetic medications as ordered, preferably before radiation. Rationale. Antiemetics should be administered before radiation therapy to prevent nausea and vomiting, as it is a common side effect. The other interventions are ineffective or inappropriate. Question 10. A 55-year-old patient diagnosed with metastatic colorectal cancer is experiencing bone pain. What is the best pharmacological approach to manage this pain? A. Administer NSAIDs, such as ibuprofen. B. Start a regimen of high-dose corticosteroids. C. Administer opioids, such as morphine, as prescribed. D. Increase the patient's oral fluid intake to reduce pain. Answer. C. Administer opioids, such as morphine, as prescribed. Rationale. Opioids are the most effective for managing severe pain in cancer patients, especially with bone metastases. NSAIDs and corticosteroids are not adequate for severe cancer-related pain. Question 11. A patient with newly diagnosed pancreatic cancer is starting chemotherapy. Which of the following teaching points should the nurse emphasize to the patient regarding chemotherapy? A. You will not experience any side effects, so no need to worry about them. B. Chemotherapy may cause changes in appetite, fatigue, and nausea. We can help manage these side effects. C. You should remain completely inactive during chemotherapy to preserve energy. D. Chemotherapy will make you immune to infections and protect you from any illness. Answer. B. Chemotherapy may cause changes in appetite, fatigue, and nausea. We can help manage these side effects. Rationale. It is important to prepare the patient for common chemotherapy side effects and provide support for managing them. The other options are misleading and unrealistic. Question 12. A patient is being considered for a clinical trial for a new immunotherapy treatment for melanoma. What is the nurse's role in ensuring the patient understands the trial? A. Review the protocol with the patient and ensure that they sign the consent form. B. Convince the patient that they should participate in the trial for the best possible outcomes. C. Provide emotional support and advise the patient to focus on alternative therapies instead. D. Review the potential benefits and risks with the patient and ensure informed consent is obtained. Answer. D. Review the potential benefits and risks with the patient and ensure informed consent is obtained. Rationale. Informed consent is a critical process that involves explaining the potential benefits and risks, ensuring the patient makes an informed decision about participating. Question 13. In managing the side effects of radiation therapy, a patient presents with dry mouth and difficulty swallowing. Which of the following is an appropriate intervention? A. Instruct the patient to increase their fluid intake and avoid spicy foods. B. Recommend the use of alcohol-based mouthwashes to reduce dryness. C. Advise the patient to stop all oral medications temporarily. D. Suggest eating dry foods to encourage saliva production. Answer. A. Instruct the patient to increase their fluid intake and avoid spicy foods. Rationale. Increasing fluid intake and avoiding spicy foods can help alleviate symptoms of dry mouth, which is a common side effect of radiation therapy. Question 14. A patient is receiving chemotherapy and presents with signs of thrombocytopenia, including easy bruising and petechiae. What is the most important nursing action? A. Administer platelet transfusions as ordered. B. Encourage ambulation to prevent blood clots. C. Instruct the patient to use an electric razor instead of a straight razor. D. Advise the patient to avoid eating green leafy vegetables. Answer. C. Instruct the patient to use an electric razor instead of a straight razor. Rationale. Thrombocytopenia increases the risk of bleeding, and using an electric razor helps minimize cuts. Platelet transfusions may be needed, but the immediate focus should be on preventing injury. Question 15. When assessing a patient's response to cancer treatment, what is the most important indicator that the treatment has been effective? A. The patient reports no pain. B. The tumor has shrunk or disappeared on imaging. C. The patient's blood pressure has normalized. D. The patient's appetite has improved. Answer. B. The tumor has shrunk or disappeared on imaging. Rationale. Shrinking or disappearing tumors on imaging is the primary indicator of treatment efficacy in cancer care. Pain management and improved appetite are important, but secondary markers. Question 16. When caring for a patient receiving immunotherapy for non-small cell lung cancer, NSCLC, what is the nurse's priority assessment? A. Monitoring for signs of tumor lysis syndrome. B. Monitoring for autoimmune reactions and cytokine release syndrome. C. Administering fluids to maintain hydration. D. Monitoring for arrhythmias and electrolyte imbalances. Answer. B. Monitoring for autoimmune reactions and cytokine release syndrome. Rationale. Immunotherapy can trigger immune-related adverse events, including cytokine release syndrome and autoimmune reactions. Question 17. A 65-year-old patient with chronic leukemia is experiencing severe fatigue. What is the nurse's first priority in assessing the cause of fatigue? A. Assess for any recent infections or signs of sepsis. B. Administer a vitamin B12 supplement. C. Provide a short-acting stimulant to alleviate symptoms. D. Increase fluid intake to prevent dehydration. Answer. A. Assess for any recent infections or signs of sepsis. Rationale. Fatigue in leukemia patients can be caused by infection, which can worsen rapidly. It is critical to assess for sepsis before initiating any other interventions. Question 18. A patient diagnosed with advanced cervical cancer expresses feelings of hopelessness and a desire to stop treatment. What is the most appropriate nursing response? A. I understand you feel hopeless, but treatment is still the best option. B. It is important that you keep fighting. You can't stop treatment. C. Let's talk more about your feelings and discuss your options for care. D. Many people feel like you do, but treatment must continue for the best outcome. Answer. C. Let's talk more about your feelings and discuss your options for care. Rationale. Acknowledging the patient's feelings and offering a space to discuss care options helps empower them and facilitates informed decision-making. Question 19. A patient with prostate cancer is receiving androgen deprivation therapy. Which of the following side effects should the nurse monitor for most closely? A. Insomnia and irritability. B. Weight gain and edema. C. Hot flashes and osteoporosis. D. Increased appetite and hyperglycemia. Answer: C. Hot flashes and osteoporosis. Rationale: androgen deprivation therapy commonly causes hot flashes and increases the risk of osteoporosis due to decreased estrogen and testosterone levels. Question 20. When planning discharge for a patient who has completed radiation therapy for head and neck cancer, what is the most critical teaching point? A. You will need to wear a wig to hide hair loss. B. Drink plenty of fluids to prevent dehydration from mouth dryness. C. Avoid any exposure to sunlight for at least a month. D. Try not to engage in any physical activity to reduce the risk of injury. Answer: B. Drink plenty of fluids to prevent dehydration from mouth dryness. Rationale: patients undergoing head and neck radiation often experience dry mouth, making hydration critical to comfort and oral health. Question 21. A patient with lung cancer receiving chemotherapy is experiencing severe fatigue and neutropenia. What is the most appropriate intervention to minimize the risk of infection? A. Restrict all visitors, including family members. B. Administer a prophylactic broad-spectrum antibiotic regimen. C. Recommend a high-protein, high-calorie diet to boost energy. D. Encourage the patient to perform moderate exercise daily. Answer: B. Administer a prophylactic broad-spectrum antibiotic regimen. Rationale: neutropenia puts patients at risk for infections, and antibiotics help reduce this risk. Restricting visitors and other options are important, but secondary to infection prevention. Question 22. A patient with a history of breast cancer reports a new lump in the same breast. What is the most appropriate nursing action? A. Encourage the patient to wait and see if the lump disappears on its own. B. Inform the patient that it's most likely benign and no further action is necessary. C. Advise the patient to schedule a mammogram or ultrasound for further evaluation. D. Recommend the patient undergo immediate biopsy for confirmation. Answer: C. Advise the patient to schedule a mammogram or ultrasound for further evaluation. Rationale: any new lump in a patient with a history of breast cancer should be evaluated promptly with imaging. A biopsy may be required after imaging, but not as the initial action. Question 23. A patient with advanced esophageal cancer is struggling with swallowing. Which of the following interventions should be prioritized to ensure nutritional needs are met? A. Insert a nasogastric tube for enteral feeding. B. Advise the patient to eat soft foods and drink liquids only. C. Encourage the patient to drink more water during meals to help swallowing. D. Suggest a total parenteral nutrition (TPN) regimen to avoid oral intake. Answer: A. Insert a nasogastric tube for enteral feeding. Rationale: when swallowing is impaired, a nasogastric tube for feeding can ensure adequate nutrition. Soft foods may not be sufficient to meet nutritional needs, and TPN is more invasive and unnecessary at this stage. Question 24. In the management of a patient undergoing radiation therapy for rectal cancer, which of the following side effects should the nurse monitor most closely? A. Diarrhea and rectal bleeding. B. Nausea and vomiting. C. Dry mouth and sore throat. D. Swelling in the legs and feet. Answer: A. Diarrhea and rectal bleeding. Rationale: radiation therapy to the pelvic area commonly causes gastrointestinal side effects, such as diarrhea and rectal bleeding. Other symptoms are less likely for this specific therapy site. Question 25. A 70-year-old patient with colorectal cancer is diagnosed with a deep vein thrombosis, DVT. What is the nurse's most important intervention? A. Start the patient on low molecular weight heparin therapy as prescribed. B. Apply warm compresses to the affected leg for comfort. C. Encourage the patient to walk regularly to improve circulation. D. Apply compression stockings to the affected leg. Answer: A. Start the patient on low molecular weight heparin therapy as prescribed. Rationale: DVT requires anticoagulation therapy to prevent clot progression and complications. Warm compresses and walking may provide comfort, but are not adequate treatments. Question 26. A patient with stage 4 pancreatic cancer expresses a desire to stop chemotherapy. Which of the following is the most appropriate nursing intervention? A. Provide reassurance that chemotherapy will prolong life. B. Respect the patient's autonomy and initiate a discussion about palliative care options. C. Advise the patient to reconsider their decision and continue the chemotherapy regimen. D. Encourage the patient to seek a second opinion from another oncologist. Answer: B. Respect the patient's autonomy and initiate a discussion about palliative care options. Rationale: the nurse should respect the patient's wishes and provide information on palliative care options to support their decision. Question 27. A patient with ovarian cancer undergoing chemotherapy presents with sore mouth and ulcers. What is the best nursing intervention to manage this side effect? A. Recommend using an alcohol-based mouthwash to cleanse the mouth. B. Encourage the patient to rinse with salt water or baking soda solution. C. Instruct the patient to avoid oral hydration until the sores heal. D. Advise the patient to chew sugar-free gum to improve oral moisture. Answer: B. Encourage the patient to rinse with salt water or baking soda solution. Rationale: salt water or baking soda solutions help soothe the mouth and reduce irritation from chemotherapy-induced mucositis. Alcohol-based mouthwash can worsen the sores. Question 28. A patient with metastatic melanoma is receiving targeted therapy. What is the most important nursing action to monitor for during treatment? A. Assess for signs of infection due to neutropenia. B. Monitor for changes in blood pressure or cardiovascular symptoms. C. Check for signs of new or worsening rash and liver function abnormalities. D. Monitor for signs of gastrointestinal bleeding. Answer: C. Check for signs of new or worsening rash and liver function abnormalities. Rationale: targeted therapy for melanoma often causes skin reactions and liver toxicity, making it essential to monitor for these side effects. Question 29. Which of the following laboratory results is most important to monitor in a patient receiving chemotherapy for leukemia? A. Hemoglobin levels. B. Platelet count. C. Liver enzymes. D. White blood cell count. Answer: D. White blood cell count. Rationale: chemotherapy often causes neutropenia, significantly lowering the white blood cell count, which increases the risk for infection. Question 30. A patient receiving chemotherapy for breast cancer reports hair loss. What is the most supportive nursing intervention? A. Encourage the patient to wear a wig or scarf to enhance self-image. B. Tell the patient that hair loss is permanent. C. Suggest shaving the head to make the hair loss process easier. D. Advise the patient to wear a tight cap to minimize hair thinning. Answer: A. Encourage the patient to wear a wig or scarf to enhance self-image. Rationale: offering options like wigs or scarves provides the patient with a sense of control and can improve their self-esteem during chemotherapy-induced hair loss. Question 31. A 55-year-old male patient with prostate cancer is experiencing erectile dysfunction due to his treatment. What should the nurse discuss with the patient? A. Suggest waiting until treatment is finished before discussing erectile dysfunction. B. Recommend medication to enhance erectile function, such as Viagra. C. Address the emotional impact of erectile dysfunction and offer support resources. D. Tell the patient that erectile dysfunction is an expected side effect and there is no solution. Answer: C. Address the emotional impact of erectile dysfunction and offer support resources. Rationale: erectile dysfunction can significantly affect a patient's emotional and mental health, and the nurse should provide supportive care and resources to help the patient cope. Question 32. A patient diagnosed with breast cancer is being considered for a mastectomy. What is the priority nursing intervention before surgery? A. Instruct the patient to stop all anticoagulant medications immediately. B. Provide the patient with a psychological assessment and emotional support. C. Advise the patient to start post-surgical exercises to strengthen the arm muscles. D. Educate the patient on how to administer chemotherapy at home post-surgery. Answer: B. Provide the patient with a psychological assessment and emotional support. Rationale: a mastectomy is a significant life event, and emotional support is essential before the surgery. This helps the patient prepare mentally for the procedure and its aftermath. Question 33. A patient with head and neck cancer is experiencing difficulty swallowing after radiation therapy. Which intervention should the nurse prioritize? A. Administer pain relief medication to help with discomfort during swallowing. B. Recommend soft foods and thickened liquids to ease swallowing. C. Encourage the patient to eat larger meals less frequently. D. Advise the patient to stop eating until they feel more comfortable. Answer: B. Recommend soft foods and thickened liquids to ease swallowing. Rationale: soft foods and thickened liquids can help the patient swallow more easily, reducing discomfort caused by radiation-induced inflammation. Question 34. A 60-year-old patient with multiple myeloma is experiencing severe back pain due to bone lesions. What is the most important nursing intervention? A. Administer opioid analgesics as prescribed. B. Encourage physical therapy to prevent muscle atrophy. C. Recommend a heating pad for pain relief. D. Suggest resting in bed to reduce the pressure on the spine. Answer: A. Administer opioid analgesics as prescribed. Rationale: severe pain from bone lesions in multiple myeloma should be managed with appropriate pain relief, often including opioids. Bed rest is not recommended for long-term management. Question 35. A patient with lung cancer is experiencing dyspnea. The physician orders opioids for symptom management. What should the nurse assess before administering opioids? A. The patient's oxygen saturation levels. B. The patient's recent weight loss history. C. The patient's level of anxiety and emotional distress. D. The patient's cognitive function and ability to follow directions. Answer: A. The patient's oxygen saturation levels. Rationale: opioids can depress the respiratory system, so assessing the patient's oxygen saturation before administering them is essential to avoid respiratory compromise. Question 36. A patient undergoing chemotherapy for Hodgkin lymphoma develops a fever and chills. What is the nurse's immediate priority? A. Administer antipyretics to lower the fever. B. Contact the physician immediately to evaluate for infection. C. Instruct the patient to increase fluid intake to lower body temperature. D. Advise the patient to rest and monitor the fever over the next 24 hours. Answer: B. Contact the physician immediately to evaluate for infection. Rationale: fever and chills in a chemotherapy patient could indicate infection, which needs immediate medical evaluation, particularly because of the risk of neutropenia. Question 37. A patient with end-stage cancer reports that they feel like a burden to their family. What is the most appropriate response by the nurse? A. Your family will understand that this is part of the disease process. B. Many patients feel this way. It's okay to feel sad. C. Let's discuss what specific worries you have about being a burden. D. Your family loves you, and they are here to support you through this. Answer: C. Let's discuss what specific worries you have about being a burden. Rationale: engaging in open dialogue about the patient's specific concerns allows the nurse to address the emotional distress and provide appropriate support and resources. Question 38. A patient receiving radiation therapy for cervical cancer reports feeling lightheaded and faint. What should the nurse assess first? A. Blood pressure and pulse rate. B. Respiratory rate and oxygen saturation. C. Skin integrity for signs of radiation burn. D. The patient's last intake of food and fluids. Answer: A. Blood pressure and pulse rate. Rationale: lightheadedness and fainting could indicate hypotension or dehydration, which should be assessed immediately. Oxygen levels and skin integrity are important, but secondary to these initial symptoms. Question 39. A patient with metastatic liver cancer is receiving palliative care. Which of the following is the most appropriate nursing intervention to improve comfort? A. Encourage frequent ambulation to prevent venous stasis. B. Administer pain medications and provide comfort measures to alleviate symptoms. C. Recommend dietary changes to slow the progression of the cancer. D. Suggest participation in cancer support groups for emotional relief. Answer: B. Administer pain medications and provide comfort measures to alleviate symptoms. Rationale: in palliative care, the priority is to alleviate pain and discomfort, ensuring the patient's quality of life. Ambulation and dietary changes are secondary to symptom management. Question 40. A patient with ovarian cancer is receiving chemotherapy and reports extreme nausea despite antiemetic treatment. What is the next most appropriate intervention? A. Increase the dose of antiemetics. B. Switch to a different class of antiemetic medications. C. Recommend acupuncture as an alternative treatment. D. Suggest that the patient refrain from eating for a few hours. Answer: B. Switch to a different class of antiemetic medications. Rationale: when antiemetics fail, switching to a different class, e.g., corticosteroids or NK1 antagonists, is the most effective approach to manage chemotherapy-induced nausea. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!